Hi, and welcome to the Anti-Politica channel. Today we're going to talk about how well different states here in the United States were able to manage the COVID pandemic, and specifically the first 2 years, 2020 and 2021. This is a follow-up video to the video in which we look at different countries around the world, and where we find that the United States didn't perform as well as Western Europe. And in addition to Western Europe, Sub-Saharan Africa really managed well with minimum disruption to regular life. And there was also a good performance in New Zealand and Australia that had very, very tough COVID measures. And then we also found that Japan, Korea, Thailand, and other Asian countries did well as well, better than the United States. So today we're going to take a closer look inside the United States and compare different states and their overall mortality rates during these 2 years. Overall mortality rates are more reliable than looking just at COVID numbers, because there are differences probably across states about how they decide what is a death from COVID as opposed to a death with COVID. In addition to that, what really matters for a state, given that all deaths are tragic, it's important for governors and state health authorities to balance different risks. You want to manage COVID and minimize the deaths from COVID, but you also want to be aware of other things going on in society, such as drug overdoses, domestic violence, suicide, and other things that may start to crop up if the COVID measures are too tough. So we believe that overall death statistics are more reliable and more appropriate measure to decide who did better than who else. So we'll look into those figures right away. So here is what we did. We went to public sources and recorded a bunch of publicly available demographic data. We recorded data for all 50 states plus Washington, D.C. And as far as the data that we collected, here is what we have. We have population in 2020. That will be an important reference point. And then we have recorded deaths from 2012 all the way through 2021. Now, these years from 2012 through 2019 were pre-pandemic. The world is in a pretty steady state in this period. You see that there is a random fluctuation of these numbers, and maybe there is a long-term trend state by state. So we can use those numbers to make a projection that is based on these 8 years. How, if you project into the future, what would you expect to happen in 2020 and 2021? And then we can compare the actual numbers that materialized, that happened in those years. We can compare those numbers to the projections based on these 8 prior years. You can look into 10 prior years, 6, 12, 20. If you look at horizons that are too long, it's questionable how representative years that go too far back are, and your results are pretty stable whether you look at 10 or 8 or 12 years. So to make things simpler here, we just recorded 8 latest years, projected based on those. And then what we did is we subtracted the actual number, which tended to be high, from that projected number, and that gives us a measure of how tough that particular COVID year was in that particular state. Moreover, you can subtract the actual number, you can subtract the projection from the actual number to get that kind of excess death toll that accompanied these COVID years. So this is just an aggregate measure of increase in mortality. We don't know whether these were COVID deaths or other deaths. Maybe COVID deaths were even higher than that because there could be a reduction in deaths due to traffic accidents and work-related deaths because there was a lockdown. We don't know that. We just have this aggregate measure of how bad, as far as deaths, this particular year was across these different states. So if you look at, for example, the state of Massachusetts, you can make your projection based on these prior years. That's captured here in these coefficients. I won't bother you with what those are now. The important thing is that we then looked at these 2 years of the pandemic, subtracted the projections, and that difference was that excess mortality that we saw in these 2 years. We divided that excess mortality by the number of people living in Massachusetts in 2020, and this gives us that in 2020 the excess mortality was 0.1% of the population of Massachusetts. The following year was better. The excess mortality was just 0.02% in beyond what the projection would be based on the prior pre-pandemic years. So for the 2 years, that gives us the overall sum of Massachusetts of 0.133%. We did an additional thing here that some epidemiologists suggest is a good idea or something to be looked into, and that is this: how bad or how good the previous year was in the run-up to the pandemic. And the argument is that if 2019 was a particularly bad year in a state, possibly due to the particularly bad seasonal flu that state experienced, then there are less frail and people with other conditions going into the following year, which can make inflate the number of deaths in that particular year. So we call that the correction. So here we have a correction for how tough 2020 was based on the excess or deficit mortality in the previous year. So we have a corrected sum for the 2 years in this last row that we have here. And these are very, very close, but we just did it to see what happened. And it doesn't matter in most states, but in some states it makes a bit of a difference. So that's basically the nature of our analysis, and we'll look at these mortality, excess mortality over these 2 years, state by state, to evaluate how those states performed in comparison to the world and in comparison to the other states. So that's the nature of our analysis. Here we have New Hampshire and Hawaii marked in gold because these states truly compare to what we call the gold standard states around the world, such as Japan, Norway, and New Zealand and Australia. So these states did an extraordinary job in managing the pandemic, and that calls for analysis. Maybe other states should look into what is it about New Hampshire and Hawaii that helped them perform so well during these 2 tough years. And these were tough years in many states. Then we have states with slightly higher death tolls: Massachusetts, Vermont, Maine, Washington, Utah, Minnesota, Nebraska, Maryland, Oregon, and Rhode Island. We call these silver standard states because they compare to silver standard states, countries around the world, and these are pretty much equivalent to what we saw in the UK, France, Netherlands, and other developed Western European countries, and some sub-Saharan Africa, and some Asian countries such as Thailand. So these states did remarkably well. Over the 2 years of the pandemic, their overall excess mortality is under 0.2% of their respective population. And then we move on to the bronze category, and in our global comparisons, the United States was a bronze level country. So here we have states that did better than the US average, which is around 0.3%. So Connecticut, Wisconsin, Colorado, DC, Delaware, California, Iowa, Alaska, Illinois, North Carolina, Virginia, Pennsylvania, Idaho, Kansas, South Dakota, Missouri, Ohio, North Dakota, Indiana, New Jersey, Nevada, Michigan, and Florida. These states did above average for the United States, and they were comparable to countries like Italy and Greece. This is still a pretty good result, but the death toll is rising. This is now between 0.2 and 0.3% of the overall population. And then we go on to the states that were subpar. They didn't do terribly, but they were below, they were worse than the US average. And that's cause for concern, and they probably need to do some studying and see what went wrong and why. So in this group we have Montana, Texas, Kentucky, New York, Georgia, Oklahoma, Tennessee, Wyoming, and South Carolina. These states did comparable to Eastern European countries such as Poland and Slovakia, and they're clearly worse than the US average. We also see something particularly troubling here, and this is something that caught our attention. The first year excess mortality in New Jersey and New York is above 0.2%, and this may have something to do with those governors' decisions to put people who came down with COVID into nursing homes. That was a big faux pas, and it seems that could be what's showing up in these numbers here. It could be something else as well, but this is something that's interesting and calls for further study. We don't have additional info, additional slices of data, but this is something that needs to be looked at. It's just an extraordinary outlier to have these two states have such high mortality in the first year of the pandemic, and they just so happen to be states in which governors made this unfortunate decision. We also see for these poorly performing states an unusually high mortality rate in the second year of the pandemic. So this is where we already have the vaccine and we know more about the disease. It could be that the strains that hit these states were particularly lethal, but it's an interesting question, and we see that here in Kentucky as well, over 0.2%, Georgia, Oklahoma 0.2 exactly. So something happened in the second year that made it really, really bad, and that's something that calls for study as well. And then we go to the worst performers: Arkansas, Louisiana, New Mexico, Alabama, Arizona, West Virginia, and Mississippi. These states had over 0.4% of their population equivalent to excess mortality over these 2 years. And these numbers are, again, this is starting to be troubling. This is several times higher than our gold and silver standard states. And again, we see this troubling aspect of what's going on here is that in the second year of the pandemic, we have more than 0.2, here 0.25% of the population equivalent to excess mortality. So this is something that clearly needs to be studied. Mississippi, Alabama, and so forth. So the worst performers lost almost 0.5% of their population over these 2 years of the pandemic. They lost it to in excess of what you would project based on the the previous years going into the pandemic. So these states need to do some homework and evaluate what went wrong and what happened. Beyond this, we can also do some additional analysis and argue that, well, there's some states are older than others. The number of elderly people as a relative fraction of the population is higher in some states than in others. And moreover, it's interesting to look at the number of obese people with weight problems, which is correlated with diabetes. These states maybe had a tougher job going into the pandemic, given that they had a higher percentage of their population be obese or suffer from diabetes and other conditions. So we did some additional analysis to try to dig into this phenomenon. This is something that we didn't have for our global data, but for the United States we have data on median age, which is really easy to obtain. You can probably do more exercise and do more rigorous study of age and different conditions that are prevalent in the population, but we just looked at obesity and median age to try to evaluate the difficulty of the job that different states faced going into the pandemic. We tried to look at obesity rates in different states and median age. Arguably older and people with obesity, which is associated oftentimes with diabetes, they were at a higher risk from the coronavirus than other people. So states with high rates of obesity and older states faced an inherently tougher job of facing the pandemic. So we tried to explain our 2-year excess death rate via these two variables of obesity and median age. So you do that by running what's called multiple regression, and Excel spits that in no time. And we find something interesting. We find that obesity clearly plays a role. The higher the obesity the higher the percentage of the population that's obese, the bigger the excess mortality during these 2 years. But for median age, we find some results that are ambiguous. It turns out that the coefficient is slightly negative, but we are not really that confident that median age played the role, because for those who are familiar with regression, this p-value here is over 0.2%. That means that we don't really have high confidence that the way this data looks, median age played the role. So we reran the regression with just the obesity, highly relevant variable, and this is what we got. There it is. We find that obesity clearly matters. P-value is minimal, so we are 100% sure that it matters. And if you look at the graph, you clearly see that it matters. One more thing, we find that obesity, if you look at the variation among the states as far as the ultimate results, more than 1/3 of that variation can be explained by the percentage of obese people alone. So obesity clearly matters, but it doesn't explain all the reasons why different states have different results. But it does explain a significant chunk of that. And if you look at the chart, you see the least obese state is somewhere around 23%, and Mississippi is almost 40%. And you see these gold-colored dots present that relationship between obesity and the overall excess mortality over these 2 years. And these blue dots are actual observations, and you see that there is still some of that variance around this line, distribution which is not captured by our model, and this is something to do with how those states managed what kind of strain of virus hit them, and the quality of care, things of that sort that are not explained. But this allows us to basically be more fair toward the states in which obesity rates were higher going into the pandemic. It was too late to do anything about it at that point, but we want to evaluate how well they did with this factor taken into account. One long-term message here is that overall health and wellness matters, and we'd like to hear more from our CDC, more emphasis on that. Clearly, being a state in relatively better shape helped a great deal, and having high obesity rates and all the problems that come with it really made things worse, and that's clearly shown from this data. But how about these remaining things that we don't capture when we factor in obesity? How did states do with respect to those residuals? So if you factor in obesity as a measure of how difficult the task was for any particular state, you can rank states beyond our gold and silver and bronze standard. We can be more precise now and argue that New Hampshire in particular gets an A+. They had a significantly lower number of excess deaths over these 2 years than even the regression line that factors in their relatively low obesity rate would predict. So New Hampshire gets an A+. A surprising result, Nebraska, given its relatively high obesity rate, really performed well. And Nebraska gets an A for its reaction to COVID, and its health system did something right that maybe other states want to take a closer look into and try to emulate. And then we have A- states: Maine, Hawaii, Vermont, Iowa, Washington, and Delaware. Now, if these were students, and some students may argue, well, you should take into account our old age and so forth. If we do that other regression with the median age taken into account, it's a kind of slightly better fit than Vermont and Delaware don't perform as well, but they still perform really nicely. Then we have our B pluses, states that in a sense did their homework and did legitimately good performance. They were at least 0.5 standard deviations below in their overall excess death toll, and these are Minnesota. If you take into account the age, Minnesota might even get an A minus. Maryland, Massachusetts, Wisconsin, Utah, Kansas, Oregon, Missouri, and North Carolina. So these states did reasonably well. Then we move on to the states that were just clustered around average, slightly above average: North Dakota, Illinois, Ohio, Kentucky, Pennsylvania, Indiana, Rhode Island, Virginia, and Texas. Slightly subpar, up to 0.5 standard deviations above the expectation: Connecticut, Michigan, Alaska, South Dakota, Oklahoma, Idaho, and Georgia. And then we get into states that underperformed. You could argue that California, Tennessee, Florida, West Virginia, Arkansas, DC, Nevada, Louisiana, and Colorado were slightly subpar. They could have done better, but it's not particularly bad. And then we get into the states that clearly underperformed. They had over 1 standard deviation above the projected number of excess deaths over these 2 years. So Alabama, Even though we factor in a relatively high obesity rate, there's still something that happened there that made Alabama's excess mortality troubling. So Alabama, South Carolina, Mississippi, New Jersey, New York, and Montana, they had over one standard deviation above the projection. Wyoming had more than 1.5, so that's a clear C minus, and New Mexico as well. And then we have Arizona. Something particularly bad seems to have happened in Arizona, given its obesity rate that's not particularly high. They ended up with more than 2 standard deviations above the projection that takes into account their obesity rate. So Wyoming, New Mexico, and Arizona, something was wrong there. And then Alabama, South Carolina, Mississippi, New Jersey, New York, and Montana, some analysis is necessary. And this goes back to our previous statement about New York and New Jersey that had very, very high excess mortality rates in the first year, and that probably has something to do with their governors placing sick people in nursing homes. So to summarize, we find significant impact of obesity on how well different states could do during these 2 years of the pandemic. It clearly matters, and it should be a lesson moving forward. And we are troubled by the fact that our officials from the CDC, Dr. Fauci, Dr. Birx, and others barely ever mention this. We haven't heard them mention this in the media, but it's an important lesson moving forward. Moreover, given that the United States underperformed Western Europe by a factor of 2, so it's a significantly worse performance than the UK, Netherlands, and even worse compared to Sweden and Norway. These people probably need to go. They didn't really manage this all that great, and in the aftermath, when all this data is available, they're not saying anything about it. There are lessons to be drawn here, and there are also things that need to be studied. We identify some states that did something right, and we identify some states that did something wrong or had a particular kind of problem. We want to hear more focus on that. We want to hear explanations. If there are bad things that happened in some states, maybe we can figure out what they are and make sure that we avoid them moving forward. Similarly, looking at Massachusetts, New Hampshire, and Hawaii, and other well-performing states, let's look at what is it that was different about them and try to replicate that. That's how you improve moving forward. And we don't hear that in the discourse of our officials almost ever. And that's something that needs to be said, and they deserve to be criticized on this point. So that's our conclusion. We suggest that you watch that other video that compares the United States to the rest of the world. Please feel free to like and share this video. That gives us more visibility on Rumble and YouTube. We are on both. And we'd love it if you would subscribe to our channel. We do all kinds of interesting societal, political, economic, and cultural topics every once in a while. We don't put out videos very often, so you won't be bothered by too many notifications. And we also have to say that we sometimes make videos in Serbian, given our background of Serbian Americans, so you can just skip those if you don't speak the language. So with that, thank you all so much. We'll see you soon.